Okay, let's start with the questions for LAMP Acuwebinar. 1. Which text is identified as the earliest extant medical classic in China?
Is this internal classic, number 1.
How many chapters does each part of Wang Di's internal classic contain?
81 chapters, number 1.
Which dynasty produced the first clinical medical book that emphasized treatment based on syndrome differentiation?
Eastern Han Dynasty, number 1.
Who authored the classic on medical problems that supplemented Huang Ti's internal classic?
Number 1, Wen Yuan.
Yeah, Qin Yuan. In the Qin dynasty, Wang Shu
Yuan.
revised a treatise on febrile and miscellaneous diseases into two separate works. What are the titles of these two revised books?
Treatise on febrile disease and synostosis of prescription from the Golden Chamber.
Which Sui dynasty work is described as the first medical text dealing with etiology, pathogenesis, and syndrome analysis?
Treatment of different kinds of disease.
Who wrote the earliest extant pediatric monograph in China titled Key to Therapeutics of Children's Diseases?
Chen Ye.
Yes. Which Song Dynasty physician introduced the theory of three causes concerning pathogenic factors?
Chen Wus. Chen Wus. Pronunciation was Chen was number 1.
Yeah. Chen Wuzi. Which physician is associated with the school of cooling, emphasizing the use of cold and cool herbal drugs because 6 exogenous factors all arise from fire?
Liu Wanzhou, number
The
1.
school of purgation advocated removal of evil factors through which three therapeutic methods?
The process emesis and
Purgation.
purgation.
Which physician's doctrine emphasized strengthening the spleen and stomach as the primary means to treat disease?
Lei Gao.
Okay. Zhu Danshi, the founder of the school of nourishing yin, argued that the body often has an excess of which element?
Is number 1 Yang.
Who first proposed the theory of pestilential qi, stating that epidemic diseases invade the body through the mouth and nose rather than the surface?
Number 1 Wu Yuk.
Okay. Which Qing dynasty physicians developed syndrome differentiation based on the theory of Wei, Qi, Ying, and Shui for epidemic febrile diseases?
Is Ye Tianxi and Wu Tong, number 1.
Which Qing physician focused on correcting anatomical errors in earlier medical works?
Number 1 Wang Qingren.
According to Wang Qingren, stagnation of which bodily substance could give rise to disease?
Blood, number 1.
Wang Di's internal classic comprises two major sections. What is the name of the second section besides plain questions?
Number 1 Miraculous Pivot.
Okay. Which foundational theory underlies the holistic concept presented in Wang Ti's internal classic, explaining the functional activities of the body?
Theory of yin yang and 5 elements.
In the Qin Yuan dynasty, which school held that all diseases were caused by evil factors and prioritized their expulsion?
School of Purgation Zhang Zing.
Which classic is described as systematically addressing anatomical structures, organs, meridians, collaterals, physiology, and pathology?
Number 1 Huang the Internal Classic.
In the classic of difficulties, which upper orifice is associated with the lung yin organ?
Nose, number 2.
Which sense is noted as not being included in the 9 orifices sense yin organ correspondence table?
Touch, number 3.
The heart chi is responsible for which specific aspect of taste?
Number two, distinguishing the
In the
five
five
flavors.
flavors. Which two lower orifices are influenced by the kidneys?
Ureter and anus.
Simple
Ureter and
questions describes five sounds corresponding to which internal structures?
five yin organs.
In the diagnostic pitfalls, what is the danger of paying excessive attention to details?
Missing the whole picture.
Which
Number one,
organ chi is said to communicate with the ears, enabling hearing of the five sounds?
kidney.
Doctor
Number two,
71 of the spiritual axis claims that observing colors and feeling the pulse can diagnose which conditions.
uh, heat or cold and painful obstruction syndrome.
The relationship table matches the tongue to which yin organ and sense.
Heart taste.
Which organ is associated with the sense of smell according to the 9 orifices correspondence?
The lung.
The
One,
5 yin organs correspond to the 5
lung.
sounds. Yes. The 5 yin organs correspond to the 5 sounds which can be detected. Which organ is paired with the sense of sight?
Is the liver.
Which
Number
of
one,
these
liver.
is counted twice in the 7 upper orifices model because of the eyes and ears being considered as pairs?
Eyes. Number one,
Ears are dry and full of dirt. The disease is in the bones. Which organ does this implicate?
the kidneys.
Which of the following best describes the anatomical location of heart 9? Shao Chung.
At the medial corner of the nail of the little finger.
Heart 9 is classified as a Chingwell point. Which additional classification does it share?
Wood points.
Which combination of actions is not attributed to heart 9?
Which heart nine is a clear heat, calms the mind, opens the lungs or orifice.
Orifices. Heart 9 is most appropriate for which of the following patterns?
Exists heat in the heart with internal wind.
Which point is primarily used to nourish heart blood for insomnia?
Heart seven,
In the context of mental health, which point is indicated for severe depression accompanied by hypomania?
heart three.
Which of the following symptoms would most likely lead a practitioner to choose heart 9 over heart 8?
Heat in the heart with loss of consciousness
From windstroke.
from windstroke.
Okay.
Two,
The classic of difficulties associates well points with which of the following sensations in the heart region?
number two.
Yeah, feeling of fullness.
Mm-hmm.
Okay, 41. Sorry.
42.
42. Which point drains heart fire for severe mental disturbances such as psychosis?
Number three, heart eight,
Which of the following is not an indication for heart 9?
all extremities.
Which point is indicated for tonifying heart chi to lift the mind in mild depression?
Heart five,
Okay.
two,
Heart 9 can benefit the tongue and eyes. Which pair of symptoms directly reflects this benefit?
pain at the root of the tongue and eye pain.
In Chinese acupuncture theory, a wood point is most closely associated with which organ system?
The liver.
Which point is primarily employed to address mental restlessness due to yin deficiency characterized by vague anxiety and facial heat?
Heart six,
If a patient presents with manic depression, fright, and agitation, but no overt heat signs, which point would be most theoretically suitable?
heart nine,
Which point shares a similar heat clearing function with Heart-9 but does not explicitly extinguish internal wind?
Heart 8.
The term resuscitation in the context of Heart-9's actions most directly relates to which clinical scenario?
Restoring the consciousness after wine stroke. Wine stroke.
Which symptom combination indicates the need to open the mind orifices using Heart-9?
Manic depression, fright, and mental resistances. Restlessness day.
Which point would be the first choice for a patient with severe hypomania accompanied by excessive dreaming?
Heart 8.
What philosophy became central to governance and culture during the Song dynasty?
Number 1, Confucianism.
How did Confucianism influence civil service examinations in the Song dynasty?
By prioritizing moral integrity and scholarly and achievement. Scholarly
Which philosophical schools were synthesized by Neo-Confucianists during the Song and Qin dynasties?
Confucianism, Taoism, and Buddhism.
What was the role of naturalism in medical practices during the Song and Qin dynasties?
Number 1, emphasizing the connection between nature and the human body.
Which new diagnostic method became important during the Song dynasty?
Number 1, tongue diagnosis.
According to Li Tuongyan, which organs are fundamental to bodily health?
Number 1, spleen and stomach.
What does a dry tongue with bitter taste typically indicate in TCM?
Heart fire syndrome.
How did emotional problems affect physical symptoms according to Song dynasty medical theory?
Equals liver cheese stagnation reflected into tongue diagnosis.
What does a dry tongue accompanied by dry throat typically suggest?
Irregular diet and overwork.
What ethical qualities did Confucianism emphasize in medical practice?
Moral integrity and proper conduct.
How did the Song and Qin dynasties' medical practices view the relationship between body, mind, and environment?
As interconnected components critical and critical to health.
What role did Mohism play in the medical and social thought during these dynasties?
Uh, Introducing universal lab and utilitarian concept in influencing health perspectives.
How many distinct
Number
pulse
1.
qualities are recognized in the pulse diagnosis system?
Number 28. Number 1, 28.
Pulse diagnosis utilizes how many positions and how many depths, respectively? Hello?
Hello. Number 1, Doc.
12 positions and 3 depths, no? Which diagnostic pillar is highlighted as being capable of revealing CHE before overt symptoms appear?
Pulse diagnosis.
Pulse diagnosis. Okay. A rapid pulse is always interpreted as a sign of which pathological condition? Hello? Yeah, number
Heat.
6. Heat. Yeah, heat.
The
Any
answer heat.
hot?
Hello.
Yes. Any area that feels hot during palpation is an indication of what?
Heat in the local area.
When illustrating liver chi stagnation, expect a wiry pulse in which specific positions?
Ah, ito siya. Sa ito yung number, Doc?
70.
Left guan and left guan or middle position.
Which of the following investigative actions is not among the diagnostic tips for palpation?
Investigate skin color.
Which diagnostic domain does not rely on pulse diagnosis?
TCM, constitutional typing.
Palpation is described as indispensable when diagnosing which category of disorders?
Muscular and skeletal problems.
What is the primary difficulty for beginners learning pulse diagnosis?
Uh, subject nature of feeling the correct qualities.
The metaphor of a roof supported by separate pillars implies how many diagnostic pillars are essential for a stable diagnosis.
Number 1, 4.
Which of the following is a relative strength of palpation?
Not dependent on the patient's interruption and
Interpretation.
presentation of diagnostic signs.
After needle insertion, which qualitative changes are observed to assess treatment effect?
Changes in pulse, abdomen, skin, and muscles.
Which depth classification is not part of the pulse diagnosis system?
Peripheral.
Employing a logical and systematic approach while studying palpation without a teacher ensures what?
That all relevant aspects are exterminated and findings are compared with textbook description.
A systematic method for becoming familiar with pulse categories is proposed. Which description best matches this method?
Number 1, feel the pulse of every patient's encounter and compare sensation with textbook descriptions.
Which skin characteristic is directly associated with the concept of heat?
Uh, Heart temperature.
What is the relationship between instantaneous pulse changes and chi?
uh, Number 1, pulse changes instantly can reveal the current state of a person chi.
Which diagnostic pillar is more accessible because practitioners can look at pictures in a manual?
Visual diagnosis.
Which of the following is not a way to monitor treatment effects through palpation?
Observing skin color changes.
What is the primary focus of scalp acupuncture in TCM?
Stimulating specific points on the scalp to treat various disease.
Which systems or conditions does scalp acupuncture particularly aim to address?
Number 1, central nervous system disorder and various internal medicine.
Gynecology.
Uh, Gynecology and pediatric conditions.
What does the holographic theory in scalp acupuncture suggest?
Number 1, the scalp reflects the entire body, allowing treatment of various of condition by stimulating specific scalp areas.
How does modern knowledge of the cerebral cortex contribute to scalp acupuncture?
Number 1, it helps identify scalp areas corresponding to different bodily functions, improving treatment precision.
According to TCM, what role do meridians play in scalp acupuncture?
Uh, Number 1, they are pathways through which chi flows, connecting bodies, parts, and influencing health.
What is the relationship between blood circulation and qi in TCM as it relates to scalp acupuncture?
Number 1, adequate blood flow nourishes organs. Stagnant blood leads to health issues. So bad blood and qi are vital.
What theoretical foundation explains the relationship between internal organs in scalp acupuncture?
Zhang Fu theory, which describes a physiological and pathological relationship of internal organs.
What are some clinical applications of scalp acupuncture?
Number one, treating cerebral disease, squel,
Sequelae
squel,
paralysis.
and paralysis due to stroke.
Why is continued research important for scalp acupuncture?
Number one, to fully harness its potential and treating diverse conditions and improving patients' outcomes.
What role does the scalp play in the body's physiological balance?
It acts as a crucial junction connecting internal organs, meridians, chi, and blood.
Wait lang. Okay. I think number one, to fully harness its potential. Mag-advance ka na. What role does the scalp play in the body's physiological balance? 94.
Mhm.
So the answer is number one, no? It acts as a crucial junction connecting internal organs, meridians, chi, and blood. Which ancient
Number one.
Chinese text first recorded the relationship between the ear meridians and the upper arms, eyes, cheeks, and throat?
Bu Shu Jing Mai.
Around which dynasty period was the Wang Ti published?
Qin and Han Dynasty.
According to the Neijing, how many yin meridians connect with the ear through the low meridians or indirectly via yang meridians?
6.
Which Zhang organ is specifically linked to hearing quality in the Neijing, such that healthy function improves hearing?
Kidney.
Which American physician reported in 1946 a relationship between ear shape and genetic kidney problems?
Edith L. Potter.
In what year did Paul Nouget publish the world's first embryological ear map?
1957.
How many auricular points were recognized by the Chinese Department of Health as its standard nomenclature in 1987?
90.
As the WHO working group meeting in Seoul, Korea in 1987, at the WHO working group meeting in Seoul, Korea in 1987, how many auricular points were officially adopted?
42. 42.
Okay. Well, of the 90 points admitted as the international standard auricular nomenclature, how many were not considered by the WHO?
36.
In which year did the final WHO General Working Group on Auricular Acupuncture Nomenclature convene in Lyon, France?
1990.
Which ancient civilization documented the use of ear needles for birth control, ejaculation facilitation, and reduction of sciatic nerve problems?
Ancient Egypt.
Which ear point recorded in the Neijing continues to be used in contemporary ear acupuncture practice?
Erzong.
Yeah, Erjong. How many somatotopic phases
Erzong.
did Paul Nouget propose in his theory of ear representation?
3.
Which French neurologist is credited with systematizing modern ear acupuncture and publishing the embryological ear map?
Paul Noger.
Internal organ disorders are reflected on which external sensory organ via the meridians?
Ear. Ear.
Which classic Chinese medical text describe bleeding the ear as a treatment for heart diseases headaches, and painful menstruation.
Nei Ching. Nei Ching.
Which modern medical theory is explicitly mentioned in the text as being combined with traditional Chinese concepts in ear acupuncture?
Neurohumoralism.
The ear is analogized to which fetal orientation?
Uh, a fetus upside down in the mother's uterus.
Which organ's yang energy insufficiency is said to cause intrusion of wind cold leading to waist back pain?
Kidneys.
What primary physiological change in middle-aged and old people leads to osteoporosis and waist back pain?
Accelerated loss of calcium.
Which scraping method is recommended for the reflection area of the spine on the inside of the foot?
Single angle scraping.
In the procedure for GB14 to GB3, which scraping technique follows the initial surface scraping?
Dual angle scraping.
What visual cue indicates sufficient scraping in the waist and back procedure?
Sha pairs. Sha pairs.
So you stop now if there's Sha. The therapy to increase curative effect advises holding a certain posture for how long?
2 to 3 minutes.
In which direction is scraping performed from GB14 to GB3?
From up to down.
The reflection area of the wrist on the third metacarpal bone of the hand back is scraped using which combination of techniques?
Pushing and scraping.
The statement that scraping only is such symptom for the time being but cannot cure it refers to which condition?
Osteoporosis related waist back pain.
Which of the following is not a cause of back waist pain?
Excessive alcohol.
Deficiency of which type of energy is linked to wind-cold intrusion?
Yang energy.
Which phrase best describes one intended effect of scraping on vital energy and blood?
Invigorate blood.
Which age groups are highlighted as particularly affected by waist back pain?
Middle-aged and old people.
Which traditional Chinese medicine concept explains the pathogenesis of waist back pain?
Stasis of vital energy and blood.
The recommended posture for therapy specifically aims to stretch which body part?
Spine.
The scraping technique used for Tiachi points employs which angle?
Dual angle scraping.
Which statement aligns with the view on calcium loss and back pain?
Calcium loss. Calcium loss accelerate the process leading to pain.
Considering the described therapies, which modern medical practice would be most complementary for long-term management?
Physical therapy exercise program.
Okay, thank you very much and congratulations.
Mm-hmm.